This is our nursing forum held for all of the 5 boroughs, NCL wide. So it's lovely to see you all. We've got in the agenda today, we've got Sam Graham going to give us a quick sort of recap on the lovely PNA programme, the work they do and how they can support you. We've got Nez and Sarah after for our health and wellbeing session on how to beat burnout and the new ways of working in primary care. And then I'm going to end with a CPD update, and any sort of update on any news. Please feel free to use the chat box. And we'll keep it, Barbara and myself will keep an eye and try and answer your questions as we go along. Thanks, Sam, over to you.
Thanks, Loni. Hello again. Hopefully you know me, or you all know me by now. So I'm Sam, I'm one of the PNAs, professional nurse advocates. There's a team of 3 at the moment, so myself, Lisa Smith and Dee Harris. And we're based remotely across the 5 boroughs, but we actually do some face-to-face work as well. So for those of you that don't know, I'll just do a very brief recap, because I think most of you have kind of met us and heard us by now. So essentially our main goal is to support the nursing workforce within NCL, within general practice, that is. And what really, I guess, what you must be thinking, what does that look like for you? So really it's a chance for nurses just to, if they want to, they can just offload, they can just kind of have a chat with us about whatever is going on in their workplace. It might even spill over to their home life, because obviously those things affect each other. It can help, clear your mind, help to find solutions that, sometimes, problem shared, problem halved, works very well. We can talk about careers, have a career chat with you, discuss what you might be thinking about, or we can, help signpost you in the direction that you may not have thought about. We have educational chats about learning needs, what may help your current practice or your career pathway. We can talk about maintaining standards and how you work to clinical guidelines. So sometimes we have those kind of chats within the clinical supervision sessions. We also support nurses and nurse associate revalidation process, and that's either reflective accounts or reflective chat, which we have to do every 3 years. I guess the message to get across to you all really though is we're here to support you. So you don't have to have an agenda. If you just want to come and chat, that's absolutely fine. The most important thing is though that you want to come, and we know that sometimes that's hard, and it's hard to make the first move, especially when it's remote. So we can come to your practice if you prefer that. If you want to have some supervision in small teams, we can also facilitate that. We did a meet and greet last week, Lisa and I did, in Hornsey, Wood Green, and it was attended by some nurse associates. We realise now, actually, geographically, it may not have been suitable for everyone. So we're hoping that we can do a meet and greet, so we can come and see you within each borough. So we'll target each borough at some point in the next month or 2. If you think actually you'd like us to come and see you in your practices, we can arrange that. Or if you'd like us to join you remotely and within your nursing team meetings, we can also help with that. We would expect you not to have your managed service. This has got to be a platform where you can speak freely. You're not going to be judged, or you're not restricted by any or languages. Dee has she has a drop-in session every Monday, so 1 till 2. So if you've just got a question that you want to fire off, please do contact her. She's sitting there waiting for your questions, or if you want to chat with her. That's going to continue at the moment until the end of July. If you want to book a restorative clinical supervision, just a one-to-one, then please go onto the NCL website, and the PNA booking information is on there. There's a QR code, and I think Barbara's just pop up the slides there as well. So if you're not sure of it, you can just scan that QR code or drop us an email. We check our emails every day, and we try to get back to you as soon as we can. So thank you for your time, and I will just, I think, hand you over to, I think Nez is next. Is that right?
Yes, thank you. Thanks so much, Sam. Thanks for taking the time to join us.
Thank you.
Nez, I'm handing over to you. Nez is our
Sorry,
health and wellbeing
yes.
lead. No problem.
Hello, sorry, I thought my screen froze at exactly the time that Sam finished, and I couldn't hear what anyone said. Hi, good afternoon, everyone. Thank you, Sloane, and thank you, Sam. So I'm Ness, the Health and Wellbeing Lead at the NCL Training Hub. Thank you all for attending today. As Sloane has mentioned, so the NCL Training Hub have been working with the Shapes ToolKit team to deliver wellbeing webinars across different roles in primary care. And as we've just mentioned, the title today is How to Beat Burnout in the New Ways of Working in Primary Care. And I would like to introduce Sarah, Dr. Sarah Coop, who will be delivering, and I'll let her give you some more details. So over to you, Sarah.
Thank you. Thanks, Naz. Really good to see you all. Thank you for your time today. So just checking in terms of finish time, what time do you want me to make sure I've wrapped up by?
I just need a 5-minute update. So it's 1:55, okay?
Yeah, perfect.
Lovely.
Just so that I know what.
Lovely.
Yeah, that's brilliant.
Thank you.
Great. Well, really good to see you. I'm going to make the session interactive because I always think online it's helpful to have a little bit of interaction. So I will share some slides to start off with just to get the ball rolling. But please do use the chat to contribute as we go through. So let me just see if I can see some slides which are showing. Yep, how to beat burnout in new ways of working. So just playing from the start. Great. So I can't see all of you in my vision as well because I'm only on one screen. So do just come off mute if there's anything that you can't see. So a tiny bit about myself. I'm a GP with having worked as a GP for about 20 years. Huge admiration for yourselves. I know how tough it is in primary care. There's so many different challenges, aren't there, that we're juggling. But my role particularly now is working as a medical educator. I've worked at Medical Protection Society. For those of you who have heard of that, it's one of the indemnity organisations, and looking at complaint themes that come through. And there's lots of interesting things that have happened pre-COVID, post-COVID around that. But it all often comes down to communication. So that's the gist of what we learn from complaints often is how can we communicate? But despite all the challenges that we're facing, it's so difficult. And I also worked at the Royal College of Obs and Gynae, which was really, really interesting because I've had such an interest in women's health. So that was been a real privilege to input into some of that as well. I'm working with Dr. Rachel Morris on the Shapes Toolkit, as we're going to look at today. So some of you might have come across the podcast, You Are Not a Frog. If you haven't, do have a look at that. It's good fun, but there's some really good tips that she brings across and some great guests on there as well. I've put on there's going to be some various QR codes. If you can see the slide there, okay. If you want to scan that QR code, it will take you through to a handout because obviously we couldn't give you anything on sort of paper, but you can sign up and receive the free handout as well. So if you want to do that, that will just be useful to do. But I'll share that QR code as we go through the session. But just give you a minute to get that just now if you haven't already. So just scan that. Brilliant. So just to get you started, just to post in the chat to start off with, if I ask this question, what stops you giving your best at work right now? So just put anything that comes in the chat. What are some of the challenges that you're facing at work right now that perhaps make it difficult to do the job that you want to? I know one of my frustrations was, just so limited often by the lack of resources and the pressure on time that felt often I just didn't feel like I was giving my best. Thank you. So we've got not enough time. Sometimes, Also, often one of the things was I knew what I needed to do, but referral pathways had changed. So I'd been thinking, right, I need to refer that patient to this service, and that service no longer existed. And that's really frustrating. Pressure, time, lack of communication. Time for communication sometimes is a real challenge, isn't it? I don't know how many of you get a chance to speak with your colleagues, at the end of clinics, or there just isn't that sort of lunchtime, is there, that maybe we had previously. Thank you. So that's one of the huge challenges, isn't it? That lack of time and too much to do. Too much to do. That's the thing, isn't there? So much on our plate, so much demand, and that's out of our control. And as you said as well, lack of services. So we're getting that kind of out of the way, but often, I don't know about you again, but at the end of the day, feel like we're running on empty. I often recall the time when I would come home to my two kids who were young at that point, and they would both be coming up to me, obviously wanting to tell me stuff about the day, but I had nothing left to give. And when I realised I was really running on empty when I said to them one day, can you get a notebook and actually write down in the notebook what you want to tell me when I get in from work, and then I'll look at the notebook and then I'll decide. And I thought, Sarah, what are you doing? The fact that you can't even deal with your children when they come in because you're so running on empty. It wasn't that it was my fault. I was exhausted from the day at work, but the fact that I was saying to the kids, you've got to write it down in a notebook before you can tell me what's wrong, really made me think, okay, what's going on, and what can I do to sort of change that so I can come home with at least something in the tank to give them before bedtime. So some of you might identify with that, maybe not the notebook bit, but that running on empty at times. And just looking at some of the research, 65.6% from this International Journal of Nursing Practice back in 2022, nurses reporting high levels of job burnout, which impacted their mental health and well-being. And that's been reproduced in various other surveys, including the Nursing Times, the NHS staff survey as well, said that across the whole NHS workforce, there was an average of 34% of the NHS workforce who said that they often or always felt burnt out due to work. So when you look at the figure on the previous slide, the 65.6, you can see that nursing staff are reporting much higher levels than on average across the workforce. So let's look at this curve then to start off with. You've probably come across this before. It's the Yerkes-Dodson curve. And you can see along the bottom, increasing pressure. And then on the side, increasing performance. So most of us know, don't we, that we need a bit of pressure often to perform well. So as the pressure increases, so does our performance on the left. And we get to the peak of the curve, just enough pressure to produce peak performance. I don't know, again, about you, but if I've got a deadline, if I've got a job to do in terms of writing a plan, an action plan or something like that, then I sometimes need that bit of pressure to actually get down and do that action plan. But too much pressure and we start going down the right hand side of the curve, and then you can see right on the far right, that performance then really drops off. And that's the challenge, isn't it, that we often feel we're on that right hand side of the curve. There's so much pressure that we're not able to perform at the level we'd like to because there's so much to do. As people said, there's so much on your plate. So looking at it in this way, in terms of numbers, I number each of those areas into sort of parts of the graph. So number one, we say not much stress at number one, just kind of, it's low stress, but also our performance isn't perhaps where we know we can. Number two is just enough pressure. Number three, as I say, is going down, and number four, often heading towards burnout. So if I just ask you to scan this and go to Slido, you don't have to register. If you scan it, you'll get straight onto the poll. That's what I was looking for. Or you can, I'll just put it in chat, you can join using this link. And I'd just like to ask you, where would you say you are on the curve right now? So 1, 2, 3, 4. So 1 was right over to the left, 3 and 4 were over to the right. Where would you put yourself on that curve? So I'm just going to share it was a bit more tricky on Teams, but let me just bear with you 1 second. Share the graph here. So I meant to do it. Sorry, there we go. So where would you put yourself on the curve right now? So these bits equal where you are on the curve. So 1 to 4, 1 being right over on the left, very little stress, but performance not as high as it could be, 4 over to the right. So where would you put yourself right now? It's anonymous. Just be good to see where you are. So again, scanning the QR code or going to slido.com and entering that hashtag 3291180, or I've also put a link in the chat. Just let people answer that. Great, keep going with that. And it's not one point in time, is it? I mean, obviously at one point in time you can feel at different places on the curve, but I guess we're looking at overall over the last sort of few weeks, maybe even a few months, where you'd say you are on average over the time. Great. So can you see there the spread of results? So we've got 22, 27% of you in 2 and 4, 25% of you in either of those. Yep, it's going down a bit because we're getting some more number 3s. Yeah. So most of you, the majority of you, recognise that you're on that 3 zone. So over the peak of the curve, heading down that right-hand side of the curve. And my question often to people that I'm coaching is, how do you know that you're there? Like, what symptoms and signs are you seeing in yourself on that part of the curve? But also, if you think back to the curve, where would you say is the point of sort of not no return, but the point of where you maybe let me just go back a slide, where there's a point between 3 and 4. We need to know that point because 4 is burnout essentially. And we need to be able to stop before we get to that point. And as we're going to go through in the webinar today, just think about what we can take control of, what is within our control to avoid going down that slippery slope. And I won't go into a lot of details, but I've been at 4 in the past. Some of you have also identified that, and it's not a great place to be. And there's different levels within burnout. Someone described it as like different degrees of burn: 1st degree, 2nd degree, 3rd degree burn. And what helps a 1st degree burn, as we know, in his skin, is different to what needs to be done for a 3rd degree burn. So I think that's why sometimes some of the resilience tips and sort of tricks aren't always helpful for a 3rd degree burn. They're useful for 1st degree, but not 3rd degree. So that's the other thing is where are we? If we're in 4th, there's probably breaking it down to, again, what part on that curve we're sitting on. So let's continue with that. So we know that it's not just about ourselves. We know also that clinicians, and this is from my work at Medical Protection Society, if we have a higher level of burnout, we have between 45 and 63% greater chance of making a medical error. So it obviously can affect patient care. And this is in the next 3 months. So if we reported, levels of sort of high level of burnout, that sort of 2nd, 3rd degree burnout, we know we've got a high level of making a medical error. And that's where the You Are Not a Frog podcast can come in, because there's lots of useful tips to help us with that, recognising both where we are on the curve, but also how we can get back to a 2 and a 3 as well. And the Shapes Toolkit that you've been having some teaching across uses the different techniques and tips in the form of shapes. And we're going to cover the zone of power, touch on the vortex of busyness, and also the square getting out of the corner in the webinar today. So let's first think about the zone of power. So if you were to get a piece of paper, if you have one to hand, do just draw a circle on the piece of paper. And the circle and the whole piece of paper represents your life. And the circle really represents what's within your control. So if you just get a bit of paper, draw a circle, make it fairly big in the centre. This quote might, before we look at that, this quote might resonate, that often people feel they don't want to stop being a clinician. They just want a bit more control back, and they want the bits that make their life disappear to go away. And they feel, maybe you feel, you have all of the responsibility and none of the control. So here's the piece of paper again. What's within our zone of power? So let's just put in the chat, what are the things that are outside our zone of power? So what in life, including at work, can we not control? So what's outside the circle? Just put some stuff in the chat. What can't we control? What sort of things? So like the weather, for starters. What else? What else can't we control? Yeah, childcare emergencies or any emergencies. Yeah, we have no control of that. We've probably all had those phone calls, haven't we, of emergencies. Yeah, can't control public transport. Yeah, Cassandra, people we can't control. That's the main thing, is that we can't control other people, much as we maybe try. We can't control what they do, what they say, what their opinion is, what they think. Yeah, we can't control other people's lack of common sense. We can't control sickness. Yeah, we can't control news. We can't control world events. We can't control government policies or managers' decisions. So we have no control over those things. We might be able to influence them, but ultimately we can't control them. So you might have written some of those around the circle. Now just go to writing for yourself. What is within your control? So just write something down on a bit of paper inside that circle. What essentially is within your control? What does it come down to? So when we think at work or even outside of work, what is within our control? And when you've written something down, again, feel free if you're happy to put it in the chat. So Catherine, you said, yeah, what you learn, but what else is within your control? So your learning is within your control. Yeah, how many times you say yes or no? And we'll look at that later. How much you do for yourself. Yeah, time management. What else? Yeah, how we spend our time, our attitude, our behaviour. So essentially, exactly, Mahalia, it's our response, isn't it, to things and people around us, and how we give ourselves a break, life outside work. So what's within our control, that circle, that zone of power, is essentially what we do, isn't it? We can only control ourselves, our thoughts. Some of them we can't control, but our response to our thoughts, our behaviours, our actions. And I often find it quite helpful when I'm coaching someone or when someone comes to me with a problem, as I'm sure people do with you, it's listening to that and then sometimes going, okay, so what's within your control? Because we spend a lot of time, don't we? And many people around us do as well, spending a lot of time being very stressed about the things outside of their control. And sometimes it just comes back down to, you know, what is within our control? Because when we focus on what's not, we get increasingly stressed and that circle tends to get smaller, a bit like our comfort zone. But when we focus on what we can control, we often then feel more powerful and productive, although it does take courage sometimes, as some of those things you put in the chat. It takes courage to say no to things. It takes courage sometimes to have a different response to a difficult situation. But as keep this in mind as we go through the rest of the webinar, what is within our control, and recognizing, you know, our choices within that, our choices about what we do, what we say, and also how we respond ultimately to other people and the situations around us. So thinking of a stressful scenario at work and just thinking what's out of our control right now, what's in our control, and what else could I do? So a stressful scenario at work often is, I don't know again about you, but often is that massive demand, isn't it, for meeting patients' needs, or the unexpected, you know, staff sickness that means that you then have got a lot more on your plate, or something that goes wrong with a consultation, and you end up running, you know, so far behind because you've got to deal with that emergency that's unfolded in front of you. That's part of your job. But then it adds so much additional stress onto the afternoon or the morning or whenever it happens. It's usually Friday afternoons, isn't it? And it's just thinking, okay, in those situations, what is out of our control? So in the emergency situation, what's out of our control is the emergency with the patient and what's happening to them and the ambulance response or the relatives response, all of those things. And we're very good, aren't we, at focusing on what we need to do right there and then. But what is also out of our control is other patients who are waiting in the waiting room. It's out of our control how they respond and how they then react. But what is in our control is how we deal with those patients, but also whether we can choose to manage our workload. If we have a choice, we don't always, do we? It's not always possible to delegate, offload those appointments, but it's how we manage that afterwards. So these situations are not easy. And that's part of the challenges of our job, isn't it? We're very good at managing very stressful situations. We're firefighting so much of the time that I think sometimes that's why we don't notice that we are heading towards that number 4 on the curve, because we're so used to being in the heat. And I guess some of what we're talking about today is looking at, again, you know, how we can control how close we sometimes get to the heat or how long we spend in the heat, and recognizing where we have a choice. Sometimes we don't, but recognizing where we do have a choice and what else could we do. And those aren't easy questions because it doesn't always feel like there is another option. And sometimes there isn't. Sometimes we have to see that extra patient who's got something really significant going on. And that means we're going to be late finishing and all of those things. But then I suppose the choice we make is we choose to do that because we want to actually do a good job. But then we'll also talk about limits as well as we go through. So just join that Slido again. I just need to exit because I need to just make sure I've moved it onto the next one because there's a new poll. This one, if I can share this, is putting things in order of what you feel you take control of best. So starting with the one that you feel you most control or manage well. So let me just share screen so you can see the next poll here. So there's 4 different things here. Hopefully you can see that. So if you go back to Slido, put them in order. So which one do you think you take control of best? Your well-being, your time, your stress, or your work life? Put them in order. So when you join that one, you should be able to rank them in 1, 2, and 3, 4. So put the first one that you think you manage best at the top, and the thing you think you probably control least well at the bottom. So let's see, as people rank them, we'll get an idea of what order you think you rank them in. What are we best at looking after? What do we manage best? And this doesn't mean we do it well or do it badly. It's just, what do we do? Let's just get a sense of where we do maybe take some control. And then we'll look at each of these 4 areas briefly as well. Great, so as you can see that live happening. I really like Slido because it's anonymous, it feels safe to use, but it's also a really good visual way sometimes of just seeing what's going on for other people, knowing you're not alone with these things. Great. Okay, so actually it's in the order of the slide at the minute still. So people feel that they probably do take control of their time best and actually managing our stress least well. But as I said, there's going to be differences between that, but it's helpful perhaps to see where we maybe try to put our attention. And hopefully by the end of the webinar, you'll have some sort of tips that you can take away for each of these areas. Some things you might be doing already, but some things you maybe are not doing. And actually we're not focusing on perhaps how we can best take control of our work life or our stress. Yeah, thank you for doing that. That's still live at the minute. I've got one more poll to do on that Slido a little bit later, so I'll share that as we go back. Continue to answer that we can see as we go through. Fantastic. So just going back to the slides again. Okay, so recognising within that circle that outside of it we have no control over our limitations, the fact that we're human. We need to meet our physiological needs. If you think about Maslow's hierarchy, if you've heard of that, I'm sure you have come across it, where at the bottom there's the basic physiological needs, you know, needing food, needing water, needing sleep, needing shelter. How many of us, and you don't have to answer this, but how many of us have sometimes said at work, actually I haven't got time to have a drink because if I have a drink I won't have time to go to the loo. And I think when we're doing that, when we're kind of making those choices, which I think many of us are, we're not perhaps looking after ourselves at that basic level. And we can't control those needs. We have those needs, don't we? Those are our limitations. We have to accept that we're human. I was coaching somebody, a clinician, not long ago. Yeah, you say it all the time. That's really good. But I was coaching someone not long ago, and they really struggled with accepting their limits. They really struggled to sort of go with the fact that they had limited time, they had limited energy. So I was spending a lot of time with them just trying to reframe it, because I think they felt if they accept they had limits, in some ways it was kind of I don't know, meant that they would have to say no to things, and that was actually the bottom of it. They didn't want to say no. But there's something about just like embracing our limits, and if you've listened to Rachel's podcast, you'll know that's a common theme for her, talking about embracing our limits and recognizing we are all limited in our time, our energy, our attention, you know, how we spend those things. So what can we do? Here's the 4 things. Taking control of our well-being, we'll look at that first, then taking control of our time, our stress, and our work life. So a few tips on each for us here. So burnout, that number 4 on the curve, here's the 3 things, the triad. So if we are struggling with burnout, and burnout is a workplace phenomenon, it's a chronic stress relating to workplace. So we can be very resilient, but because of workplace issues, we can become burnt out. So it's not a resilience issue so much as a chronic workplace stress that many of us are experiencing. Remember that figure early on. And this is looking at how we can try and keep ourselves in that healthier zone of 2 and 3. But just for interest, the research shows there's 3 aspects of burnout. I'm not going to go into those in great detail, but firstly, lack of empathy. So we can start to find that we just have so much emotional exhaustion that I find it really difficult to have that empathy for others that we would have done. And feeling really, really exhausted and depleted, not just physically, but it's often emotionally as well as mentally. And then that results in poor performance or suboptimal performance. And because we know how we want it to be, that increases the sort of frustration and exhaustion, because we just recognize that we're perhaps not performing at the level we want to, and therefore that just reinforces the sort of the exhaustion as well. So those are the 3 areas. And I guess I really want to say that if you notice and know that you are heading towards burnout, do seek help earlier on. As I said earlier, I struggled with that. And I think one of the issues was, we're so driven often, and we're so determined to keep going, that sometimes we can end up stretching ourselves so much that, we get past that point of no return between 3 and 4. So if you recognise that, do seek help early on. Because it's important to take the time that you need to get back to a healthy state. One of the challenges, as I said, is keeping on stretching, and we can often end ourselves up in this vortex of busyness. So this is one of the shapes in the shapes toolkit. So you'll see that on the slide, and it looks like this. So when we're busy, when we have so much on our plate, when there's so many people demanding things of us, so many requests happening, that we end up just working harder. When we've got more to do, what we tend to do is try and do more, to try and sort of get to the bottom of it. But for many of us, when we overwork and overfunction, we end up then not sleeping so well. So you can see that there, feeding to fatigue, leading to physical symptoms of anxiety, leading to that lack of joy, and then ultimately lack of hope and burnout at the bottom. So thinking about it this way, here's another slide. I need to activate it in a second. But when the workload builds up, what's the first thing that you give up? So I know when I was heading towards burnout, I stopped exercising, I stopped taking a lunch break, I stopped seeing my friends, because I was trying to do all the amount of, trying to get through the workload. So just going to Slido again, I'll need to activate the poll. So there's the reminder, but I'll just need to go to the website. When your workload builds up for you, what's the first thing that you give up? So you can just put a word or two in here. So again, it's anonymous, it'll make a word cloud. But when workload builds up, what's the first thing that you give up? Is it exercise? Is it seeing friends? Is it socializing like that? Or is it sleep? Do you give up, going to bed at a reasonable time because you're trying to work late into the evening? Do you give up a day at the weekend trying to catch up with admin tasks? So what's the first thing that you give up when the workload builds up? Great. And the more people that say a particular word, as you know, with these word clouds, the bigger it is. So yeah, socializing, yeah. Yeah. And the reason this is so important is because that's often one of the first symptoms and signs that we're moving from number 3 on the stress curve to number 4. So I know now that if I stop having a lunch break, even when it's so hard to take a lunch break, I know that's a sign that I'm moving into the danger zone. If you think of number 4 on the right hand side of that curve being the danger zone, for me, if I stop thinking that I can take a break because I've got too much to do, then I know that's a sign for me. So this is why I guess I wanted to really highlight this. If you know what the first thing is you give up, that's the really helpful way of going, okay, that's probably the thing I really need to do. And if I'm starting to give that up, that's dangerous. That's a danger warning sign. And just having that awareness can be really helpful. It doesn't mean it's easy to do it. I mean, again, when I'm feeling exhausted, exercise is probably the last thing I feel like doing, but I know that actually that will be really helpful. And sometimes that isn't the right thing to bring us back into the safety zone, but it's knowing for yourself. We're all different, as you can see on the slide here, we're all different, but recognizing that first warning sign and then being kind to ourselves and going, okay, what do I need to do to bring it back? Great. So just sharing slides again. Thank you for that. So you should be able to see the slides again. Just always let me know if it sounds like I'm talking to slides and you can't see anything, please tell me. Yeah, so how do we reverse that cycle? Because it's not easy when there's so much being demanded of us. And again, you'll all have different things. That's why I think, it's not always helpful, is it, to sort of say, right, you just need to do mindfulness, or just need to do exercise, or you just need to walk in nature. All of those things have their place, but it's what's right for you and what would be the first thing you can do that reverses that cycle, moves you back into that 2 and 3 on the curve. But for many people, it is around finding the things that bring us joy. So on that word cloud, when you think about the things that you put, that's the first thing that you give up. Often it's because you get some joy in that, whether it's socializing, having a lunch break, just a bit of joy, making a nice lunch. Often we don't get the chance to do that. But what's one thing for you? And just put it in the chat. What's one thing for you that brings you joy? So what brings you joy in life? Even for me, making a cup of tea in a really nice mug sometimes, a small thing brings me joy. But what's one thing for you that brings you joy? Yeah, holidays. Change of scene. So it could be a big thing, it could be a small thing. Yeah, getting away from London sometimes. I was in London yesterday and it's great, but the day was enough for me. Yeah, finishing clinic on time. Yeah, doing artwork, seeing friends, meeting friends. And there's a lot of research coming out now on joy. It's not something we talked about many years ago, but again, it's such a personal thing, and it's the real antidote often to that overwhelm. And some other research I was looking at on burnout was saying that the people who have had burnout and have recovered have often really then invested in something that brings them joy and made that a priority. So, what it is, knowing for us, often we give up that hobby or that sort of second, I don't know, not second life, but there's a word for it, it's a phrase which I've forgotten, but something around that sort of second life that kind of gives you life, I suppose. So work isn't that first life, but often that's what we spend a lot of time investing in, isn't it? And gives us a lot of satisfaction. But what's the joy life, I suppose? What's the thing that it could be small things, bigger things, but just everyday things as well, the micro joy moments. I try and look for those in the day as well. What are the small things? So someone's looking back at a photograph that brings me joy as well. So really important to recognize those things. It's stuff you know already, but often it can slip, can't it? And how do we bring that back? So just thinking about that, yeah, lots of you have put some you've got that insight into what's important for you. Go back to the slides. So we know that being human is outside our control, so we need to come back to some of those well-being basics. And again, often one of the first things we said that we give up are those things on the bottom of Maslow's hierarchy of needs. Having that time for recovery, that time for rest, for restoration. So coming back to the well-being basics and just ensuring that we make those things a priority. So different ways to well-being, you've said some of these in the chat, connection, giving, giving in ways that then actually energize you. So whatever that would be for you. Learning and playing, again, whatever that is for you. Noticing, so if we're in nature or that fresh air and sunshine, as you said, what it is that we notice that again just refuels us. So this is all about fueling ourselves again. If we think about energy depletion, I often think of this as like a bucket, and when we're depleted we end up at burnout when we're empty, aren't we, and our tank's empty. What do we do to put some deposits in that actually keep that balance more healthy? What's stopping us from sleeping well that we need to reverse? Eating well, and we'll come on to setting some boundaries in a little while, but that's so important as well, because we are limited. We have to then set boundaries about what we can do. So the ABC, what can we do that helps to keep us active? What can we do to protect our breaks, those moments of micro recovery? Again, lots of research has shown, a bit like in the sports world, that we can't stay in the performance zone all the time. We need recovery, just like in a tennis match. If you're into watching tennis, when Wimbledon starts, every couple of sets they'll stop and have a short break before they play again. But often in the healthcare, particularly in primary care, I think we are on all the time. We're performing all the time, and our breaks are the things that get squeezed. But we know that if we can take a short break, we then fill the bucket up a little bit to give us something to draw down on again afterwards. So how can we protect those? And then C, how can we ensure that we've got connection? So the ABC, really simple, but sometimes I have to say to myself, where's my ABC today? I look at my diary or my lists and go, right, where can I carve something out? And again, what's within my control to do that? And where am I letting other people dictate my ABC? And how do I get that back? So part of that is controlling our time. And because many of you said that's the thing that stops you giving your best at work, is lack of time, but also how we use our time and how we let other people decide. And some of it is without our control. So it's come back to what is within your control. So I don't know if any of you have read the book, 4,000 Weeks. That is probably the average number of weeks we'll all have in our lifetime. I'm well over the 2,000, but it's that sense, isn't it, of just really recognizing how many weeks we actually have in our life and how many hours in a day, and then thinking, okay, so what do I really want to prioritize? Quite sort of sobering in many ways. So another bit of paper, if you can get a piece of paper and just divide it into 4, and you might have seen this before, the prioritization grid. So this is another of the shapes. And in that 4, so let's divide it like this. If you draw it like this, it's a little bit simpler. So you've got urgent on the left-hand side, and you've got important going across there. So you've got top left, urgent and important. Top right, not urgent, but it's important. Bottom left, urgent and not important. And bottom right, not urgent and not important, so neither. Now, if we had a longer session, we'd be getting you all to look at your to-do lists, look at your diaries, look at the way that you spend your time, and recognise what do you put in each of those different quadrants. Because what that often tells us is how we are spending our time and also what we're prioritising. Now, of course, at work, a lot of the stuff falls into urgent and important top left. That is just our job. Most of the stuff we're faced with is urgent in that it needs to be done quickly, or it has the appearance of needing to be done quickly. And it's important. It's part of our job, but it's also something that we know we need to do. So most of our work and time is spent dealing with urgent and important. However, a lot of our time at work is also spent dealing with urgent but not important. Does anyone have anything in the chat that they can share with that's maybe stuff that you recognise you spend your time on at work? And this is not judgmental at all, because I do too, but we can get into a bit of an urgency trap. So stuff that's urgent but probably not that important. What sort of things might fit into that quadrant? What can you think of that you find yourself doing at work that's urgent but probably not that important for you? So I'm thinking about quite a lot of meetings. Hopefully this isn't one of them, but quite a lot of meetings I can sometimes think, especially in some of the roles I've been in, where I'm like, actually, why am I in this meeting? Do I need to be here? Did I need to be here for the whole meeting? So that's one thing. Emails that you're CC'd into. Actually, is this important for me? Or is this just someone else's urgent, where they've not prioritised it and now it's become urgent? They desperately need my help. And perhaps this was something that wasn't urgent to start off with and now it is. So it's interesting to think how often we can spend our time getting stuck in the urgency trap. On the wall, I'll show you in a second the way I filled it in myself. What about top right? So actually, let's think about bottom right. So the not urgent, not important stuff is often the things that we don't need to do. It's not that important. But often we've ended up, because we're so worn out from all the stuff that we've done at work, that we end up spending time procrastinating or doom scrolling, just looking on websites or it's social media, and we just kind of end up down a rabbit hole for a couple of hours sometimes in just doom scrolling because we're just so worn out. And so the bottom right is often the stuff that we don't really need to do, but we find ourselves using our time for, because we're just worn out. We almost have stopped kind of deciding how to do it differently. I'm just going to move this round. Can you, if I spotlight myself, is that working? Can you see me bigger now?
Yes.
Yeah. And can you see the writing on the wall at the back there? Oh, not very well.
Not clearly, no.
Not clear. Let me just move a little bit nearer. I just want to show. Just tell me as I go to it. So just I've got the grid labelled. I'll show you what's in each one. So top left, is it the right way around? It's not back to front mirrored, is it? Is it the right way around?
It's the right way around.
Yeah, good. So top left, we've got the emergencies we have to deal with, crises that could be within or outside of work, the childcare crises or other people's illnesses, deadlines. We have to deal with that at work, don't we? Patient demand is urgent and important. Escalation, things that get escalated to us because of our roles, we have to deal with them. And the sort of deliverables, so the things that, are part of our service delivery. That's what we spend our time often doing at work, and that's appropriate, that's our job. But as I've said, we often end up also spending a lot of urgent and not important doing some of other people's stuff. So some of other people's emails, some of other people's tasks. Can you just? meetings, some stuff that's CPD that isn't that important, and other people who've made decisions for how you're going to use your time, like I said, with sort of meetings. So we spend a lot of time at work up and down what I call the urgency trap, because we're so busy doing stuff up here, we don't realise we've ended up just carrying on doing all of this stuff as well. We get really sort of trapped in that must do it, tick off things, keep going. We're in the urgency trap. So we then end up coming home, and outside of work, we end up spending our time. I've put here, this is not judgmental, but I know for myself, mindless recreation. I'm so exhausted. I collapse in a bit of a heap, unhealthy coping strategies, bit zoned out, or I procrastinate and don't actually, because I'm just worn out from this stuff, that I don't have good energy left. And so I don't use it particularly well. So there's a bit of a triangle going on here. Urgency trap, worn out. I end up doing things that are not important and not urgent. What I don't then do is the stuff here. I then don't do the things that are not urgent, but are important. The things like true recreation, putting value in my relationships. Maybe it might even be things at work, like I don't get round to doing that strategy or that thinking and planning on a project. I don't have that really good focused time. Maybe I don't effectively delegate, I just do it. And I maybe don't have that time on sort of looking at succession planning if that's part of my role. This is our zone of power. So the circle comes in here as well. The stuff that we need to be doing, the not urgent but important stuff, is our zone of power. The thing is, we don't often do those things like the strategy, the planning, looking after ourselves. And so then it becomes urgent. If we don't do those things when they're not urgent, they then end up becoming urgent. So like the recruitment or the project that needs to be done tomorrow, or the presentation that needs to be suddenly delivered, or the relationship breakdown, or my ill health because I haven't prioritised my health. So that's why the zone of power actually fits in really well with the prioritisation grid. But the trouble is, as I said, often, and this is me, myself, often I've ended up here getting more and more sort of stressed and burnt out, here thinking I'm just resting, but I'm not really restoring. And so I don't ever get effectively down to this bit because of all the demand. Anybody else identify with that? Any questions about that?
Sarah, do you mind telling us what's on your list for non-urgent, non-important?
Non-urgent, non-important. Yeah, I've put mindless recreation.
Mm.
So that would be, yes, like I say, sort of going on to social media of some sort and then sort of scrolling down one thing, or going to the news and then kind of going down one story to another. So, or it could be any kind of unhealthy coping strategy. So there's nothing wrong with Netflix, but, you know, just maybe watching one after another, and then end up staying up too late and then not sleeping well as a result and then getting tired. So it's where I haven't planned it out strategically or intentionally decided to do that, and I've just sort of fall into it. So it's that sort of unconscious, I suppose, trying to get some recovery, but it's not effective recovery. So it's those things that don't refuel us, they don't give us anything long term, if that makes sense. There's nothing wrong with some of that in terms of just a bit of restoration, but if it doesn't actually help us and it drains us further in the long run, we end up not then having the energy for that top right. And it's that top right which is the bit we often neglect. Thanks. Any other comments on that? You might have come across that prioritisation grid before. So Stephen Covey made it quite popular in his book, 7 Habits of Highly Effective People. But I don't think I'd really appreciate it till I really looked at it again and thought about how I get stuck on that left-hand side and the urgent, because we are so used to ticking stuff off, you know, mentally often. And we're so used to just doing. And also people coming to us with things, patients, you know, needing attention, that we forget. If you think horizontally, so across the middle, there's something we call the line of discernment. So if you've drawn this on a bit of paper, just write that in. Horizontal line is the line of discernment. How do we discern whether something is urgent or important? But actually the line of discernment is about whether it's important or not important. So at work, how do we decide when something has the appearance of being urgent? Is this important or not important? And that's when we need to say no. Or we need to delegate, or we need to eliminate. That's the challenge. So I found the line of discernment really helpful, both for the right hand side, where I'm thinking, actually, if I choose to watch this series back to back, what's going to be the consequence for me? Is this going to actually help me or not help me? And yeah, what would be a better use of my time that will give me the energy then to do the things I need to do? So it's just putting you back in your power, isn't it? And so there's nothing wrong with any of those things, but it's putting you back and making you recognize that we have that choice. So just to go back to the slides to share a little bit more. So you can see there the not urgent, the grid again, and this is in your handout, so you can download these as well. So there's that line of discernment and giving ourselves that, I suppose, moment to stop and think. Do I have a choice here? Yeah. So recognizing that top right, we want to plan to do those things. If we don't schedule them in, it's like lunch breaks, isn't it? I started, where possible, sort of blocking it in my diary in one of the jobs that I did. And actually, it really meant that other people, well, still tried to book meetings in sometimes, but then it meant that I had to then think, well, if I say yes to that meeting, where am I going to have my lunch break? But planning to do certain things, like the things that bring you joy, are they things that you can schedule? Maybe not, depends what they are, but planning to do them means they're more likely to happen over those things that we can control. Obviously, urgent, important, we need to do now. But below the line, those things that are other people's stuff, if we don't have to do it, if it's not important, can we eliminate it? Can we say no? Can we automate it? There's some things we can automate. So depending on your software that you're using in patient consultations, if you're using System 1, some of you might be using EMIS, or other systems, there are ways of automating some of the things that you find yourself doing repeatedly, like some of the admin tasks. You can have automated replies to things that you can set up on macros. So if any of you are very good with IT or know people who are, there are certainly ways of sort of hacking in a good way some of System 1 and EMIS's functionalities that can make some of the things easier. Also, what can we delegate appropriately? And obviously delegation can then increase load for other people, but it can also equip people, upskill people. So it's just checking with ourselves, do I need to be doing this? Or actually, is it someone else's job? Or is there an opportunity here for someone else to be upskilled that would actually help them and would help me? But it does take time initially, doesn't it, when we delegate, and we need to do that skillfully. So a few productivity hacks, I guess, as I've said, just scheduling time in our diaries and where can we block time. One of the things that I found most helpful when I'm coaching other NHS professionals or managers or leaders, blocking in at least a half hour a week for what I would call review time. So this may not be possible for you, but trying to protect some time for review. So that means looking back over the previous week, catching up on some of the stuff you maybe haven't had a chance to do, maybe reviewing actions from minutes, or it might be something that's an audit or some other quality improvement activity. And then looking forward to over the forthcoming week, what do I need to have in place? And it's a really good way of sort of just protecting some time to take stock and step back, but also see where your time is being used. And it also gives you a little bit of what I call bucket time for sometimes those things that fall over. So an hour is perfect, but I know that's not always possible. Different jobs, I've been able to do different things, but I've certainly tried to have some protected time because that's what I've learned is really, really important. I've said about delegating, automating, eliminating, batching. So when you think about your time in the workday, there's a lot of evidence that shows if we can batch tasks, we're much more likely to be productive. So if you put things together, like all your admin for, say, test results together, or if you're looking at letters like discharges from hospital or prescriptions, anything like that, batch them, because if you're in the zone doing that task already, you're actually going to be on a roll. We know that anyway, but often what we find is because things come into us ad hoc, we tend to respond ad hoc. So again, can we batch certain things and think, right, I'll do all of my things in that go, unless it's urgent. 15-minute rule. This is really great for the procrastinators amongst us. I've got things I'm struggling to kind of get started at times, and I'll set myself a timer. It's called the Pomodoro technique. Set yourself a timer for 15 minutes, because if you start it you know the time is going to go off after 15 minutes. You can decide that's it, I've done 15 minutes, I can stop. But usually what happens is after 15 minutes you recognise that you've either getting there, if you're halfway through, or you've really had a breakthrough and you probably carry on. So 15-minute rule can be really, really helpful. Recognising good enough. Any of you who have a tendency to want and I like this, want things to be perfect, there's a saying that good enough and done is better than pending and perfect. So I try to tell myself that, okay, is it good enough and it's done, then that's better than pending and perfect. And that can help me sometimes just go with it. Interruptions. I've been doing quite a lot of quality improvement working practices recently, and interruptions cost so much time. So if interruptions are a real challenge for you, people coming in, you know, can I just, then recognizing, you know, how can you manage that? Is there any way that you can limit the interruptions proactively by saying to people, I'm not going to be available at this time, if that's possible? So eliminating actual physical interruptions, but also distractions. We know that if we check our phone, it probably takes about 23 minutes to get back into that sort of into the zone at that same level of concentration. So can we eliminate some of those interruptions? Can we turn off notifications? Those sorts of things that might just drag our attention in different ways. And also looking where we have some control. Do we have any control over being able to do our best work, our deep work at the best time? You may not in the way that your clinics and things are set up, but if there's something you particularly have to really focus and go deep in, know when's your best time to do that. Are you better, do you have your sort of most concentration in the morning? Can you then schedule that in the morning, or are you better focused in an afternoon? So just using that proactively as well can be really helpful. So there's a few people who need to leave. That's absolutely fine. I'm conscious of time. So I just want to finish with this one, really, just recognizing your boundaries. And so a tip here is to say, if you say yes to something, what are you saying no to? So we need to say yes to our priorities, those things in that top right zone, which means we have to say no to some of the stuff in the bottom part of that grid, don't we? But also, if we want to say no to something or someone, it's often because we want to say yes to something else. So if I want to say no to someone, I'm often say, well, actually, I need to say no to that because I want to say yes to this instead. And so that's often that thing about choice, and recognizing we have that choice between whether we say yes to something, what we say no to. And if we do say yes to something, what does it mean? What's the implication for us? If we can say no to it, what's it going to give us back? And so that can often be really helpful in terms of just sort of shifting that guilt from sort of having to do everything that we need to do. So I'm conscious of time, and I've just realised I've gone 2 minutes over, but I've got an evaluation to share with you, which I'll do. But I know you want to just wrap up, Saloni, so I'll pass over to you while I find the evaluation, if that's okay. And thank you for that quick whistle-stop tour, some sort of tips and tools and insights, hopefully, that's been useful.
Very useful, Sarah. Thank you so much. I've been making lots of notes. I'm sure others have as well, but thank you. It's really, really helpful. So while you're looking for your evaluation, just a very, very quick update. If you haven't completed your training needs analysis, everyone, please do so. It's the last day today to get all your training needs heard. So please do that. Barbara, thanks for sharing the link for that. We've leg ulcer training for those who aren't already doing leg ulcer. It's not an update. It's theoretical training, day 1, and half a day for day 2 on the practical session. There's venipuncture training on the 4th of July, and we've got standards of student supervision. That's triple SA training on the 20th of June. All this information is in the newsletter, the weekly newsletter that goes out. Just wanted to highlight some updates. We don't have a NCL wide forum in June because we really want to encourage all of you to attend the celebration event on the 16th of June. I really hope you can all come along to that. Again, the link to join, to ask for your ticket, to register rather, is in the newsletter. Our next forum is going to be 19th of July, and then we're taking a break from the NCL wide forum in August. So that was my very, very quick update. Any questions, obviously, please email one of us, any of the borough nurse leads, and we'll get back to you. Thank you. Sarah, have you found your evaluation?
It's in the chat.
Lovely.
Yeah,
Lovely.
thank you. Barbara put one in, but I just think this is the one that's specific for this session.
I was just going to say, I passed it on to Barbara because on the other sessions we didn't have one, and we usually had posted one in the link into the chat. So I had given that to Barbara to post. But yeah, do go ahead and use the SurveyMonkey one if you're able to share that after. But yeah, we didn't usually have one from both sides, so we made one as well. But thank you, Sarah.
Yeah, well, if we use this one, we'll make sure we get you the outcomes back to you. Yeah, thank you.
Amazing. But yeah, thank you so much for coming along today, and
it's really good to see
and everyone.
Thank you so much, everyone.
Saloni, could I make one really quick, just because I know that I don't I'm not on the agenda for this, but really just headline. We are promoting the NCL Valued Awards again this year. It started last year, and we've got the nomination process open for anyone really across primary care, anyone within practices to nominate their team or organisation for initiatives that have impacted staff wellbeing and staff teams in general. So if I can just pop that in the link, because it's the page on the NCL website, because I don't know when I'll gather all of you all again. Is that okay if I just put it into the chat box?
Please do, yes.
Amazing, thank you.
Thank you, Ness. Thank you.
That will be.
Thanks so much. Thanks for organising the session. Lovely.
No, thank you for having us.
No problem at all.
Thank you. Thanks so much, everyone.
I hope you all have a good afternoon. See you soon.
Yes, you too.
Thank you.
Thanks, everyone.
Bye.
Thanks very much. Bye-bye.
Bye. Bye.